All right. Welcome everybody to our May Ag Behavioral Health Working Group. Thanks for those of you that were able to log on time. We might have others joining as we get going. I see Tim logging in right now, but I wanted to open up for anybody that is joining us from the public. We do have Spanish speaking interpreter available, and I'm going to let Eric make a brief introduction to those of you that would like to participate in Spanish.
Ok, bienvenidos a nuestro grupo de mayo de salud de comportamiento. Gracias a aquellos que pudieron entrar a tiempo. Vamos a comenzar. Tim va a estar metiendo ahorita. Entonces vamos a hacer una breve introducción y vamos a tener interpretación en vivo en español. Para conectarse, lo único que tienen que hacer es picar los 3 puntitos y va a salir un globo. Ahí usted va a poder escoger el canal en inglés o en español, ya que empiece la interpretación. All right, if you want to join in another language, Mr. Wilson will be turning on interpretation pretty soon. You should see a option there from a globe, or you can click the 3 little dots, and you will see a globe, and you'll be able to choose channel English or Spanish. Okay, go ahead, Mr. Wilson.
Thanks, Eric. All right, and for the rest of the public that's joining, I do want to make you aware of the Q&A function at the bottom of your screen, even though you're not on the picture with the working group. We would value your input, and any questions that you have, please feel free to offer those at any time. There will be a time at the end of the call for folks to come off of their mute and also ask questions if you'd prefer to do that. That should be around 2:20-ish if we stay on time. So with that, anything else that I'm missing on those beginning intros, Robert?
Yep, I think you're good.
Right on. And we have members that are coming along. I would invite you, if you're able to turn your camera on so that we can see you. That's always helpful. Jacob, I know that you mentioned that your camera's not working, and some of you are at conferences, so if you need to let us know that, feel free. And we have at least one person that's sitting in for a member, so I will let them introduce themselves shortly. The rest of you, if you want to say your name, who you're representing, where you're joining us from, and maybe something that you hope for this summer, something that you hope will happen, something that you hope in your life, and that'll be good. And I will start us off. And then I will call on somebody and trust that everybody can just pass it on to somebody else after that. Last time when I had to call on people, I am always afraid I'm going to forget somebody. So I'll just let you take that responsibility. So my name is Clinton Wilson. I am the chair of this Ag Behavioral Health Working Group. I'm a member of Rocky Mountain Farmers Union, and I work at CSU in the AgriBility program. I'm joining from campus in Fort Collins, and this summer I hope for rain. And I'm going to pass it over to Chet.
Sorry, I had a hard time finding my mouse there. I'm Chet Nelson. I'm an emergent family therapist. My office is in Broomfield. I'm hoping that my son's recent mountain bike injury will heal, but it looks like it's going to take some surgery. He busted up pretty bad. Kind of going to wreck his summer. And I will pass it to Chad Rusnak.
Hey, good afternoon, everyone. I'm Chad Resnichek. I'm with Colorado State University AgriBility Program and Extension. Glad to be here. I'm in Johnstown, Colorado, and my hope for the summer is to get in as much fishing as I can. Nice. And I will pass it to Tyler.
Thanks there. Hey, everyone. My name is Tyler Garrett. I'm the Director of Government Relations for Rocky Mountain Farmers Union. I'm here to speak on something a little bit later, but also was one of the main proponents of the bill that created this work group. And so glad to see a lot of you again this summer. I'm really looking forward to honestly just taking a little break. We're going to go back to Arkansas and visit some family, and it'd be nice just to spend some time with some people. So I'm going to pass it over to Tim Miller from Farm Bureau.
Thanks, Tyler. Appreciate that. I had a feeling you were gonna pick me. Yeah, Tim Miller, Colorado Farm Bureau. Enjoying the downtime and getting out of the fog, post legislative session here a little bit. Things that I'm hoping for, this is my first year in the legislative session, and there's some topics that I'm hoping to pursue a little further, mental health being one of them, and agriculture, along with learn a little bit more about water, and then also on the renewable energy side too. So with that said, I will pass it along to Callie.
Hey, Calandra Lindstadt. I am the Behavioral Health Administration, BHA, Northeastern Regional Community Engagement Specialist, and I'm the statewide Ag Liaison. I am normally in Loveland, but I'm calling in today from our BHA Summit here at the CU Anschutz campus in Aurora. Dude, this health building is freaking gorgeous. I'll turn off my filter at some point so you guys can see it. It's beautiful. I am hopeful, looking forward to getting up the Cashlaputer Canyon. I have access to a very rustic fishing shack up there, and it's my happy place. There is no Wi-Fi. It's the most incredible thing. You just get into that canyon, everything cuts out, and that's my goal as many times as I can this summer. And I will pass it to Julie.
Hi, I'm Julie Elliott, Behavioral Health Specialist with Colorado State University's Extension and Agribility Program. I'm located in Grand Junction. And for the summer, just cooler weather than what we normally have during the summer months here in Grand Junction. So rain and cooler weather. And I don't know, has everyone gone?
No,
I'll pass it to Catherine.
Excellent.
Perfect. Hi, everyone. Sorry, my camera is not on because my coworker is driving us through Leadville right now. So I'm in Leadville. Hi. I am the Rural Strategies Specialist for the Office of Suicide Prevention. We are housed at the Colorado Department of Public Health and Environment. Something I am hopeful for this summer, I am going horsepacking in Mongolia for over 3 weeks. So I am very hopeful I don't get tick-borne encephalitis. I don't know what that is. You're supposed to get vaccines for it. I did not because they were really expensive. So everyone keep your fingers crossed for me. Thanks. And I am going to pass it on to, let's see, Jacob, have you gone yet?
I have not. Thanks, Catherine. Jacob Walter, apologies again for my camera not working. I took some vacation and my camera did too. I'm coming to you from Fowler, Colorado. And I'm an associate director for CSU Pueblo, but on here for some ag background and family experience. One of the things I'm looking forward to this summer, after many years, I am graduating with my master's in June. So I'm looking forward to that. And I will throw it over to Casey.
Hi, good afternoon. My name is Casey Schmidt. I am the Director of Healthcare Innovation and Strategy at Valley Health Systems. So I'm sitting in for JC Kaliga today. I am located here in my home base is La Junta, Colorado. I am my kiddos are 5th generation, born and raised in Southern Colorado. So I'm excited to be here with you today. I'm looking forward to the rain. That's what I was going to say as well as the cooler, hoping for some cooler summer weather than we typically get in Southeast Colorado, as well as just maybe a slowdown as I had my oldest daughter graduated from CSU, go Rams, this past weekend, and my oldest son graduated from high school last weekend. So busy week. Excited for some slowing down.
Excellent. Thanks, Casey. And I will pass it to Rosie.
Hi, everyone. My name is Rosie. I am a program assistant of sorts here at CDA, and I'm helping out with this working group. I keep my camera off because I'm furiously typing meeting minutes, not as much an active participant of this group. This summer, I am looking forward to, we have our first round of our climate resilience grants here at CDA. The application closes in 2 days. And we're already seeing a lot of really great projects. So I'm excited to be able to put some funds towards drought resilience, wildfire resilience, and winter storm resilience this year. And I will pass it to Robert.
Thanks, Rosie. And Rosie, thanks so much for all your help, all the work behind the scenes that you do. Really appreciate it. So I'm Robert Sakata. I'm the Ag Water Policy at the Department of Ag and volunteered to help with this effort because it's really dear and close to my heart. And my hope for this summer is that it's been an amazing mental health month of May. And I would just like, and not, this all being new to me, it's just been amazing, all the things that are going on. And my hope is that we just continue it throughout the year. So thanks.
Here. And I think that's everybody. Was there anybody that didn't get a chance to share? All right, we did that pretty quick because we've got a slim group today, so we're going to stay ahead of schedule and keep going. Excited for Tyler to get to join us and give us an update on the RMFU AgWell program. So Tyler, I'm going to pass it over to you.
Thanks, Clinton. Really appreciate it. So, and thanks for inviting me to talk about this. I'm sure many of you know that the AgWell program, which is what Clinton used to do when he was with us at RMFU, and so he was our director. Oh gosh, I should have wrote down the date beforehand. About 6 weeks ago now, 6 weeks ago, we received notification that our RASIP, or the Western Regional Agricultural Stress Assistance Program grant, was frozen, and that we were, ordered to cease operations on those fronts. This is a part of the larger, broader freeze on a lot of programs right now that we're seeing, some affecting, different things such as, climate grants, things along those lines. And so what this did, though, was put in jeopardy the program itself that we do here. AgWell, through RMFU, provides, ag and rural behavioral health information, as well as overall well-being information and programming to help farmers and ranchers and members of rural communities strive and destigmatize getting help, as well as a lot of other really important things, really in alignment of what you are doing here in this work group. So we hit the ground running as soon as we found out about this to figure out what we need to do. We reached out to our congressional partners, reached out to the USDA. We did a lot of outreach in the media. So you may have seen some of the stories that came out about this through print media, as well as some of the news stations. Our president, Chad Franke, was all over the airways for a good week or so. So we've since been told that, along with a lot of other federal grants that are pretty up in the air at the moment, that this will potentially come back, likely come back, and hopefully sooner rather than later. So we're still waiting to hear on the time frame. That's what we've heard from about a few different grants. And in the meantime, though, we were able to move money around in RMFU to ensure that we can continue our AgWell program and keep the staff that we have for that. But at the same time, we were having to cut some of the programming that we were doing. We were lucky, though, to secure a large grant with the Rocky Mountain Health Plan to help cover through this next year. And so with that, along with the return of the RASIP grant, hopefully in the coming months, we'll be able to continue our programming. I will say it did put a big stress, though, on particularly Clinton's replacement and some others who, as soon as they found out, were wondering if they were going to still have a job. And so that's one of the things I think right now that is going on with a lot of people in ag and rural areas, is determining whether or not what their future looks like if some of this funding doesn't come back or if it's frozen. And so just one of the broader topics that I hope that you all are discussing. But happy to answer any questions. I'm not sure what else you'd like for me to say, but I'm here, happy to answer questions, and want to chat about what's going on. And Clinton probably can fill in some more than I can, because he's been involved in some of these conversations as well about what to do here.
Tyler, I would be curious, just because we do have a couple minutes, if there's any updates from the legislative session, as Tim mentioned, it's done, that might pertain to any bills or conversations that would be beneficial for this group to know about. I don't follow the legislative session as closely as you two do. And so I'd love, along with your AgWell update, thanks for that, if you could give any other updates that might be helpful for us.
Yeah, this was an odd session this year because there's no money. The state budget was originally projected at around a $1.2 billion deficit. I think after final projections, it was just a little under 700 million. So there was a lot of skimming off of departments. Luckily, the Department of Ag weathered pretty well. They came up with a plan to not cut programs, but to trim back some programs within BHA. One of the, they definitely were a target of some legislators, and some of the school funding for behavioral health was definitely targeted and cut. And then there was, the voucher program, $50,000 that goes towards the voucher program. It was originally slated to be cut, but then due to some maneuvering by a legislator out in the Eastern Plains, she was able to save those funding. And so legislative wise, there honestly not a lot, I think, in this realm, other than just keeping an eye on budget. Now we know that as we come up for next year, the budget was tight this year. It was not great, but they were able to find places to trim. Next year, those places have already been trimmed, and the budget's supposed to look worse. So just keep an eye out on that, making sure that we continue to elevate the importance of this topic, so that way when it does come around for discussion, this is not something on the chopping block, is what I would recommend. But really, legislative wise, not really a lot in this space. We know that after you all submit your report to the legislature, that will likely produce some more legislation that we can work on. So
great, thanks, and thanks for all your work on the legislation that did create this working group, Tyler. Tim, while we're on it, anything that you want to add? You seemed inspired beyond just this group to support ag behavioral health. Was there anything that was mentioned or that you know of that
I wouldn't add it? No, Tyler covered it pretty well there. The hope here is that, this is, whatever this group ends up producing, that there will be some, at least my hope, some real just, gravitas, I guess, that, we can bring to them, and some suggestions, and just kind of see where those discussions go. But I think, it's a good time to talk about these things. If there's things that cost money, we're going to have a little bit of an issue, as Tyler talked about. There just isn't any, and they're going to have to work to probably figure some things out next year. So, but no, nothing new I want to add. But I really hope that we as a group can bring something of substance forward to everybody.
Fantastic, thanks, Tim.
Yep.
We have a question.
yeah.
We have a
Go for
question
it.
from Kristen online. So is camp still operating and accepting new clients?
Yeah, camp is still operating. You know, as Tyler alluded to, it was on the cutting block, but we had a legislator, Representative Dusty Johnson, stepped in and you know, kept the program. And honestly, she just in small discussions with her, she hopes to be able to keep it in the future. We'll see how that goes. But yes, the short answer is yes. Camp is funded for the next 2 years.
Awesome.
Great. Thank you.
Anything else, Robert?
And Tyler, I put the link to AgWell's website in the chat.
Thank you.
Going through it, I see, are you still doing the online fundraising for the program?
They are, yes. One of the things that they were doing is some of the online fundraising for it. And it was 2 weeks ago that Kyle Clark, we were part of his week of giving. So we were his targeted program for that week. And so did raise some funds for that. So at the moment, we are able to continue AgWell through next year and hope that this RASEP grant will come back so we can make sure that we can continue not just the program, but the programming that we do and build that out further as we continue forward.
Great. Thanks, Tyler.
Anything else before Tyler logs off? Any questions about legislative stuff for RMFU or AgWell?
No questions, but just a comment that how much I appreciate the advocacy that RMFU did. Obviously, we're kind of in the same boat. A good chunk of our funding comes through RASAP as well. And you all were so timely and so considerate and thoughtful in your messaging. I just really appreciate it and the efforts you do to look out for all of us by extension. So thanks so much.
Thanks, Chad.
And
Really
Tim,
appreciate it.
Tyler and Tim, both y'all standing up and working with our policymakers and doing what you can to support this work behind the scenes in those environments. It's hugely, hugely appreciated.
Well, thank you all for letting me join. I'm going to turn the camera off, but so I can do some other things, but I'm going to keep listening in. So
right on. Thanks, Tyler. All right. Well, luckily, Dr. James logged on early, so I hate to throw her right on the spot as soon as she's here, but I'm really excited for us to get an update from you, Dr. James. Thanks for joining us. I'm going to let you do a little bit more of an introduction of yourself and your work, if you don't mind, before we have a little bit smaller group than normal, so our introductions went fast today. So thanks for being here, and I'm going to turn it over to you.
Great. Thank you, everyone. The university's internet has been spotty. So for the presentation part, I'm going to put myself off camera just to ensure that I'm not breaking up the entire time. But for introductions, hi, everyone. It's nice to meet you. My name is Kathy James. I'm an associate professor in the Center for Health, Work, and Environment and Department of Environmental and Occupational Health at University of Colorado Anschutz Medical Campus. And I've had the pleasure of working with the San Luis Valley for nearly 20 years. And over the past 5 years, as we've learned more about the drought and how drought impacts health effects, I've been working with the agricultural worker population and have partnered with several community groups down there in looking specifically at mental and behavioral health, food security, food access, and then also toxicant exposures through water quality as a result of depleting water sources. So the work that I'm going to present is the results of our agricultural workers survey specific to behavioral health. And the reason this study came about is because I was meeting with several key leaders in the community, and with more of a focus on how pesticide applications were shifting with increase in drought and differences in irrigations. And many of them kept saying, well, they're like, we appreciate that notion, but actually what's the biggest issue is mental health. And so over the next year, we spent time learning more about what's been the farm workers have been experiencing, and then that led into this study. So happy to be presenting. I'll be off camera while I'm presenting. I'm going to share my screen real quick. Start the slideshow. Still a little way to reshare because it's got my presentation mode. There we go. Okay. This should be my screen slideshow mode. Okay,
that looks
great.
good. Thanks, Kathy.
Great. All right. So the purpose of this study, I'll just jump right in the presentation because I've already introduced myself. First, I always like to acknowledge all of our partners. We have partners at CSU Extension, Farmers Union, AgriSafe, all of our community partners, and including the farmers and farm workers. So the main objective of this work was first to identify and characterize what is the state of behavioral health and well-being among all of the SLV agricultural workers. We focused on farm owner operators and then permanent and temporary residing field laborers or farm workers. And we did this through using a survey called the WellBeQ. This was developed by NIOSH. And we also incorporated within that a social network analysis. And the purpose of that was not only to learn about what is the state of well-being and behavioral health, but then also what resources do farmers and agricultural workers use, and then flipping that script back, what community groups engage with field farm workers and farm owner operators. And I'm sure many of you know, so the San Luis Valley is a major agricultural community. Unfortunately, only 4 out of 6 counties, or 4 out of 6 counties do not have a licensed psychologist, and they have some of the lowest median incomes and levels of resources for the community. Simultaneously, they're also experiencing one of the most devastating droughts. Oops, sorry, that was automated. In the West, aquifer systems are declining, snowpack is declining. We're seeing increases in aerosolized dust, loss of topsoil, the decline in the vadose zone. And all of this has impacts on crops, crop production, the health of farm productivity, which also then has an impact on stress, anxiety, and mental health and well-being on farmers, on top of the inherent physical health that drought has been shown to also have. For this study, we did utilize the total farmer health model, which is part of AgriSafe, and I apologize, I don't know why this is automated. And this is coupled with an integrated model from the Total Worker Health, which is a framework through NIOSH. So our specific methods, we included 2 types of network analyses. We did a survey. The survey was long. It was actually 45 minutes, and we recruited, as a convenience sample, 221 agricultural workers, and they completed, some completed it online, but most people completed it in person through community events that we hosted. The survey included the WellBeQ, and then 2 depression and anxiety scales, along with the information about resources, which is, so when we talk about network analyses, these are surveys and analyses that identify how people are connected and to what resources, and what resources are then connected to people they're connected to. So it's kind of like a Kevin Bacon type thing, you know, who's connected to who in the 6 degrees. We also included community partners that were identified as actively working with agricultural workers. So this is a graphic of what a social network analysis looks like, where we're asking people, who and what organizations do you rely on when you need help? And then how are those people and organizations connected to each other? So it creates this spiderweb map And what this helps us identify is, one, what resources really should be targeted funding or programs to connect with agricultural workers, and also what connections do they have to other organizations that can also help support getting agricultural workers resources. So I wanted to highlight our recruitment. We did have a community event in each of the counties. Our largest event was located in Center, and we partnered with a local restaurant food provider that many of the field workers and field laborers attend. And we provided food, we provided childcare. We had the Valley-wide Mobile Health Clinic came, the CDPHE's COVID immunization and other immunization clinic came. We had multiple translators. We had both Spanish and Quantable translation. We also had a mental health specialist on staff in case someone experienced trauma or an event. And we had multiple organizations also there to provide people with information on legal services, food services, and housing services. We also had people there who could help them with each of the surveys, because we recognized that they were long. Everyone was compensated $40 in a Walmart gift card to complete this survey. So I'm going to shift now into the results. So within the surveys, we had a 70% completion rate with majority of the people being Hispanic or Latino, and about an even distribution of male and female, and an expected trend across both income group and age, with the income group trending more towards the lower income. About 76% were field workers, which was really important because oftentimes they're an hard to reach population when it comes to research and surveys. And so making sure that we were able to hear those voices was very important to us. For the most part, people were fairly new within like 5 years of being on the job. However, of course, we have our generational farmers that also participated in the survey. One of the questions that was asked in the WellBeQ was for them to identify chronic conditions that they are currently experiencing, and they could select multiple. Not unexpected, farmers have more injuries and pain, and so the other musculoskeletal disorders ranking the highest was not surprising, but we were surprised at the significant reporting of depression. This was well in line with the anecdotal information that the community leaders and I talked about prior to launching this study. And so this study reinforced that and provided some really interesting data. Blood pressure and arthritis also were not too surprising. Asthma, the St. Louis Valley has some of the highest rates of asthma, so additionally not as surprising. When we look at various well-being factors associated with farming, many of them reported a very high rate of fatigue, and surprisingly not a whole lot of other chronic health conditions, although they were higher in the owner-operators. Work injury was very high. This is especially true in the field workers, with many of them reporting an injury in the past year. But however, all of them report pretty good overall health status, with less than 25% or so reporting fair or poor. When it comes to health risk behaviors, we looked at risky drinking, and as was reported anecdotally, our owner operators, alcohol tends to be the concerning drug. This was also reflected in the survey. Cannabis use was also discussed, but it's not as much of a concern as it is in other populations or working populations. And tobacco use was higher in the field workers. When it comes to workplace safety and injury, Again, the fatigue factor is probably the biggest concern, with many of them reporting that they work in a fatigue state, getting less than 6 hours of sleep. 22% of the field workers reported that they feel somewhat unsafe, and 8.3% reported some level of bullying, and around that for sexual harassment. When we look at the mental health outcomes, anxiety was less, but depression was significantly higher, with 30% of the farm workers who temporarily reside in the San Luis Valley having that higher rate at 29%. One really great thing, and you know, and this to me is no surprise. I come from an agricultural background. Granted, it's dairy farming in the Midwest, a little bit different than out here, but there is a lot of job satisfaction and a lot of positive viewing of agriculture and farming as a profession, and that feeling of contribution to the community and overall society. So overall, regardless of which group they were in, they all felt very strong about their work and very satisfied with their work, and viewed it very positively. Same thing when we look at overall life satisfaction. They report very high satisfaction with life. And, you know, one thing of note is that they did say that they don't quite have the support outside of work that we might anticipate or we would see in other careers, with most of them saying sometimes, rarely, or never. So these next two slides are the ones that really had a lot of traction with the community itself. So one of the questions we asked the agricultural workers was, what is your area of greatest need for positive well-being? And we did stratify these by owner-operator and field workers and field laborers. And not surprisingly, water scarcity was the #1 concern for the owner-operators, followed by mental and physical health, technology help, and health insurance. Interestingly, though, for the field workers, and the numbers over here represent the farm owner-operators for context, but the #1 concern by far for field laborers was food. And many of them reported food scarcity, access to healthy food, and being able to feed their families as their greatest source of stress. This is even more of a crisis now. Just in meetings with the Public Health Partnership and public health officials, due to cuts in funding to food banks, this situation has gotten significantly worse. And the interesting thing and really cool thing is, like, the SLV Ag Coalition, they have also begun to really bring food into the conversation when they talk about mental health and well-being, especially for farm workers and laborers. So coupled with getting kind of that state of well-being, we also wanted to find out what are the resources and who do they go to? And the average network size, so we asked them, like, who and what are options for support. Owner-operators had more, with 4.4 members, whereas field workers, it was about 2.6. Most of these were household, friends, neighbors, and coworkers. And so the questions we started asking ourselves is, what organizations do people currently network with for resources related to well-being? And so when it comes to like this, we invited some of the organizations that were highlighted by the workers as being a source of, as a resource for well-being and mental health. We invited 26 organizations and we had 22 participate, which we were really pleased, and just again continues to reflect the commitment on the community's part to supporting farmers. And here are the organizations that were highlighted by the farmers and farm owner operators and field laborers and workers with the ones that are in the box there were the ones that had the strongest number of connections. So BOCES, Los Promotores, the Workforce Center, Tierra Nueva, Valleywide Mobile Clinic, and the SLV Immigration Resource Center. We also asked organizations what were some of the barriers that they found that hindered some of the referral for farmers and farm workers. A lack of financial resources was the number one. And then, interestingly, poor communication and lack of trust between the partners and the referring groups. The other one is that was spoken a lot of was lack of infrastructure. How do we streamline and process through these referrals through a more systematic process? And then kind of conclusion. So in speaking and getting some qualitative information from the farmers, but then also from the organizations, the key needs in serving agricultural workers, number one is having support available for farmers and farm workers at any time. As we all know, farmers don't work banker hours, so having evening hours, weekend hours, having a provider that could do home visits, or being able to visit migrant camp or housing areas, having an increased presence of behavioral health providers on settings that are frequented by farm workers, such as community events, community gatherings, churches, having Spanish-speaking therapists, also having those flexible hours, and then having providers that are culturally knowledgeable about agriculture, what life is like in agriculture, and understanding that work-life balance that is so important for agricultural workforces. The other things they brought up were collaboration for improving their referral and screening system, and more resources that don't necessarily require extensive collection of information, but at least in collection of information to identify people that are in agriculture. And that is it. I'm happy to take any questions.
Thanks so much, Dr. James. That was great. Who has questions for Dr. James while she's online? And I guess one question that I have, Dr. James, is the report that you guys have for this, is that something that's in a shareable format that we could share with this working group so that they could have that?
Yeah, absolutely. We created a community report that's in both English and Spanish. And so I can share both of those with you.
That'd be great. If you wanted to send that to me or Robert, we can have Rosie share that out with the rest of the group, because I know when I saw that, that was really powerful.
Yeah.
And great job capturing it in the slides. I just know that there's a bigger story when you get into all the data. So thanks. Who has questions?
I have a question, Clinton. Thanks,
Robert.
Dr. James. You might have said it and I might have missed it. When was the surveys done? What year?
Oh, yes. Sorry. Great question. So this was in 22 and 23. So we kind of straddled. We started in August, which, that's potato harvesting season. So it really began to pick up in the winter when farmers were more their downtime. But we extended into April and May of that next year because we really wanted to get input from those that are temporary workers and migrants. So we included migrant, H-2A, and temporary residers.
That's great, because I know the outreach work that the Department of Ag is doing now, there's a higher level of anxiety in those communities right now. So
oh, absolutely.
That would be reflective if it was done again today.
Yeah.
And Robert, when you're saying those communities, do you mean the ag worker community or both communities of the owner operator and ag workers in the San Luis Valley?
Focusing on the ag worker community.
Okay. Yeah. Callie, I see your hand up.
Dr. James, that was awesome. Thank you so much. I am curious about if you asked whether or not the ag workers had family in the region with them, and then if you had any measures of like sense of belonging or like sense of isolation or loneliness, just because I think one of the things that our farmers have is maybe a slightly stronger sense of community where they're at, but I think that may just be an assumption. I don't know, so I'm really curious about that.
Yeah, that's a great question. We didn't ask specifically about family outside of the context of who are your resources and who do you seek help from. I can definitely say based on some of the answers, we did have people who don't have family because they referred to their horse and their dog as their main resource for well-being. And but many of them did have families. Many of them, they came as a couple because they are both working. So the wife worked in the packing facility and the husband worked in the fields. And so many of them came together. And in the regards to the loneliness, we did inquire about loneliness and other kind of detailed mental health factors like that. We did not dive that far. I mean, there was probably over 120 questions, so we didn't report on that one specifically.
And then we have a question from Bennett who's listening in, and it kind of goes along with, I think, your flow charts, but what role did community behavioral health care play in your study? Did the community perceive their services as useful or accessible?
That's a great question. So one of the community organizations that participated, multiple. We had SLV Behavioral Health Group, we had SLV Health, Valleywide. We also had, and I apologize, I forgot the name, another mental health and well-being practice. So we did include several clinicians or clinical-based settings, and interestingly, they did report that they do have engagement with farm workers. What they'll see quite a bit is with farm owner operators, it's more stress related to the water, what we saw. But one thing that didn't quite come out quite so clearly in our survey that anecdotally they told us was that many of the farm workers come to them as a result of TBIs. So we didn't ask specifically the type of injuries. We just asked about injuries in general. And so TBI seems to be what they get the most common referral from, but they don't get many referrals specifically for mental health well-being of farm workers. It's usually as a result of an injury, like loss of limb, TBI. So it's more of a PTSD related.
Any other questions for Dr. James?
Dr. James, I was going to ask the same question that Clinton asked about whether or not you'd be able to share some of those results. This is obviously an area in a population that really is underserved and needs some tailored specific supports. And so, and as I'm sure you're aware from doing all the backing research to get your project together, there's not a whole lot of information out there to guide people's efforts. So this is hugely beneficial. Part of our work group is tasked with identifying gaps in information. So this will definitely help fill that. And you may already be familiar with it, but I wanted to drop in the chat the RASAP farm worker survey that included responses from about 556 workers. I believe that's about the number, but I don't have a great recall of the specifics, but it seems like there was some overlap between some of your findings. Colorado was not super well represented in that okay. report, but for anyone interested in looking more at the specific needs of this population, I'll just drop it in there for some additional information. But really appreciative of your work there in the San Luis Valley. So thank you for coming on and sharing that with us today.
No, it's my pleasure. And we are, we have been working for the past year to develop a, like, what is the next step? And partnering with the SLV Ag Coalition, Valleywide, Los Promotores, and other organizations specifically to develop an intervention like, Chad and Clinton, I've talked with you both about this next step. And then also met with Morgan and Loran at HICAS specifically on what is the next step. Unfortunately, with NIOSH going away, that next obvious funding mechanism disappeared. So we are scrambling a little bit right now and working to try to find a funding mechanism that'll support this. And yeah, so keep your ears peeled. Like I said, we're definitely looking to partner with you and other experts. I'm not even though I was raised in farming, I don't consider myself an expert in the research in that area. But I definitely enjoy community engaged work and working with the San Luis Valley and the networks that were established with this research project and more importantly, the connections it made within the community is definitely a momentum that I don't want to see lost. And so that's why it's great to be talking with all of you and hopefully the next step can come out of this.
And Dr. James, just to follow up on that, if somebody did identify maybe some funds for their area of Colorado, what would be the best way? Because it seems like a lot of the work has been done on the front end, getting the surveys and the tools put together to do this work. Is that something that if they brought that to you and your team, that expanding to the Southeast or the Northeast or something would be reasonable in your capacity or scope? Yeah.
Yeah, absolutely. There's actually been areas like Lamar, Ouray, and just south of Palisade there. So getting into some more of the fruit agriculture has been areas of interest of mine, and people have also expressed interest, especially in protecting the workers, especially as they have some additional stressors.
Okay, great. That seems like a further conversation. We have some working committee groups that we're going to be forming over the next couple of weeks. And one of them is going to be looking at next steps for data collection and how we support not only these efforts that have been done for your next steps, but also how we expand that reach. So awesome. Well, thanks so much again for joining us. And we will forward on the full report to the rest of the team, or the rest of the working group and those that aren't here. But if there's another question, is there contact? I can't remember if you put that up on a slide, but contact if people wanted to reach out and ask you specifically.
I'll put it in the chat right now.
Perfect. Thank you so much.
Yeah.
Great. All right. Thanks a lot, Dr. James. You're welcome to stay on the call if you want to hear the rest of it, or if you need to get on to the rest of your busy day. Thanks for joining for this time. That was really informative.
Great. Well, thank you so much. I do have another meeting, but
excellent.
Talk to you later.
Thank you. Bye. And before we move to the next step of our agenda, I want to acknowledge that Casey was replaced with JC. And JC, welcome. And you missed our introductions at the beginning, but you got anything that you're hoping for this summer that you can share with the group just to keep the connection alive?
On a serious note, about a 1/4 inch of rain every week or every 4 to 5 days would be fantastic. And on a fun note, a few more wins for my women's softball program. So we're playing right now all over the state, and we can always use a few more wins. So both of those I would take.
Love it. And you stayed consistent. Casey represented the request for water when she made her hope. So you guys obviously got hive brain going on down there, bringing water to the Southeast. Welcome. Glad you're able to join. All right. Next part, I think we're going to jump into working group ideas or work plan groups. We have met a couple of times to break down the goals that everybody submitted to kind of get them into some categories, and we mentioned them last time. and Callie, Chad, and Catherine have agreed to take on the lead role in each one of these groups that we broke out. So if you have the agenda pulled up, I want to direct your attention to the goal spreadsheet. It should be under point 4. And in there, you'll see 3 goals that are broken out. We looked at this last meeting, but Chad has agreed to take the lead on the compile best practices. Catherine has agreed to take the lead on identify gaps in data on outcomes. And then Callie has agreed to take the lead on engage with other stakeholders. So I'm going to ask each one of them. And it looks like that right now, Catherine is in a low spot. So if she's not able to make it, we can explore that. She put a tab in that spreadsheet, but first was just going to let each one of them talk a little bit about their thoughts for this committee. And the goal is that by this Friday, each one of us would put our name beside one of these committees that we'd be willing to work with this group to report back to this larger group about our work plan for achieving those goals. So Chad, I'll let you, since you're first on my list, give a brief pitch for the compiled best practices group.
Yeah, so good news and bad news here. The good news is there have been 2 systematic reviews, pretty comprehensive, that have analyzed over 300 different published articles in some way impacting behavioral health outreach and interventions for ag populations. That's the good news. The bad news is both of them came to the same conclusion, was that there was not enough evaluation outcomes and data to really be able to identify these are evidence-based solid practices that can be done. But all things considered, that was 2023. So the nice thing for this work group is that instead of having to go back all the way to the 80s, we can pretty much move from 2023 and look at anything that helps direct, inform, and guide our choices as we go forward. So I'm not sure if it'd be helpful. I've got both those systemic reviews. I could drop in the chat if anyone wants to see those now. I didn't see a way to put them in our working document. But I have them, I could send them, I could drop them in the chat. In fact, I may do that just so that they're easily, because these meetings are recorded, I'll have them in one spot then, but I'll drop them in there. So ideally, what this sort of work group would do would be to analyze whatever journal articles we can get, and through our CSU Access, we could share a bunch of those. Journal of Rural Mental Health would be a good one, Journal of Rural Health. There's quite a number of them we can go through and just look at, are there any other evaluation outcome data that's been associated with intervention since 2023 going forward? And if any of that is helpful for the work group doing gap identification, be glad to share those that way as well. And then for collecting data on behavioral health outcomes, which is also part of this work group's our collective goal. We are working to bring some outcome evaluation into the CAMP program and also into the LandLogic model to really move that towards hopefully more of an evidence-informed practice. So it's both a bit concerning that there's not a lot of evidence and data to support these efforts, and it also really underlines and highlights the importance of, as we try to make an impact in this area, whatever we can do to reflect that impact and to keep good data on that, it's helpful for us and everyone around the country doing this type of work. So it's important work, and we need to document the importance of that and the impact of it as well. So with that, if there's any questions on that particular goal, I'll take them. Otherwise, I'll pass it to who's ever next.
Thanks, Chad. Any questions for Chad before we move over to Callie?
I'll just add, I think that'll be really critical, Chad, especially for our final report. So any way that I can help, let me know.
Agreed.
Sounds good. All right, Callie.
Okay, yeah, Catherine sent me a text saying that she was going in and out of service and dropping every 30 seconds. So maybe we can, one of you guys can just share what her subcommittee is. So we decided that we needed a subcommittee for communication, outreach, promotion, and I will be heading that up. I basically am thinking that we will put together a strategy and a plan to harness some, free media, PR, and leverage as much of that as possible early on, gain some recognition and awareness around this group, and then build towards that summit to really make sure that we have good coverage of the whole state once we get to that event. So just looking for folks who are interested in helping to develop this plan and strategy, putting together a contact list that is as robust as we can make it, putting together press releases, helping to tell the story of this group and what the goals of the group are. So.
Awesome.
Yeah.
Questions for Callie and the Engage with Stakeholders subcommittee?
Kelly, this is a question and not really actually toward this goal, but I know BHA is on the road doing, what do you call them? Conversations and resource fairs or something. Can you tell me a little bit about what that is and what's going on there?
Yeah, so we are renegotiating the whole behavioral healthcare system with the launch of the BASOs, the Behavioral Health Administration Service Organizations. It's going to simplify the whole process of getting behavioral health support, and in an effort of promotion and engagement for that launch, the commissioner of the BHA will be traveling to, I think it's like 12 or 13 different locations. We're doing resource fairs, so convening local resources and organizations to come before. And then the commissioner will speak, do a little description of the BASO launch and engagement with the community. So last year we really had an open mic. People were able to talk about the things that are important to them in their community around behavioral health. I think they're going to be really awesome. We had a pretty solid turnout last year, and we're able to get to more of our rural communities. So we're not just in Denver, which is really important.
That's great. Yeah, I reached out to I see the first one I think is in Alamosa next week. So
yes.
I reached out to some people I know there, and so they wanted to know could they set up a booth at this fair, or what goes on?
Robert, send them to me. That's awesome. I know it's a little bit tight since it is next week, but I think we can make most things work. So please feel free to forward them on and I'll connect them with the team. And then thank you for the platform. I should be doing a better job of this myself. Here I am talking about the communication strategy. I will send to this group, to Rosie, our rock star, I will send all of the events coming up and make sure that that announcement goes out, because we will be all over the state. Would love to see folks and would love to feature folks at the resource fairs.
Great. Thanks, Glenda.
Yeah.
Awesome, Kelly. And since Catherine's not on, I want to point everybody towards the work group work plan. And if you look at the bottom, Catherine did create a tab knowing that she might not be on the call, and you can click on the data infrastructures and outcomes tab, and it kind of shows the work plan that she has in line or in store or in development for this group to be exploring together. And so I'll give us a minute to look through that.
And Chad, as we're thinking about these subcommittees, I think this is such an awesome opportunity to potentially slot in CSU students, either from the College of Ag or from public health. I don't know if that's, if that's something you guys have thought about.
Yeah, we actually have an intern on deck that's going to help us with the literature review, in addition to
Awesome.
a number of other things to help keep our heads above water. So, yeah,
Perfect. Cool.
good idea.
And I'm sorry, I'm trying to find this where I can put my name in, and I'm having trouble tracking it down.
Okay, so if you're on the agenda and you click on the goal spreadsheet on the
Okay.
first page of the goal spreadsheet, there's a column F and it says sign up here. And so if
Gotcha.
once you identify which one of these three subcommittees that you would like to be on, if you will put your name under the sign up here. I know a number of folks have put their name under person responsible, and they put it next to specific goals. But
Yeah.
I'm one of those that I think made it more complicated. We just need to put our names out beside the subcommittee that you want to be in. So
Okay.
essentially, in those person subcommittee responsible, it should be Chad for the first one, identifying gaps, kind of got moved together with collect data, and that's going to be Catherine. And then the bottom one, engage with stakeholders, is really just Calandra. So we can populate to the right under sign up here. And as we discussed earlier, the question came up before this meeting, if people could be on more than one subcommittee. And if you're inspired and want to support more than one subcommittee, by all means, feel free to join as many as you'd like, just not more than 3.
Okay. Thank you. Thank you.
All right. Any other questions about signing up for that? The request is to do it by Friday. I think that we'll send out a follow-up email to this meeting to remind folks that are not on this call to sign up by Friday, but sign up there under column F. And with that, we will try to get back online. And the last thing with that, you guys will determine with your subcommittee chair when you meet on a monthly basis, and hopefully be able to report out at each monthly meeting that we have. And then as it goes along, it might be less than monthly, but you'll determine that with your chairs. So next up is the Department of Ag to give us a update on our meeting in person in June, reimbursement procedures form, and then we'll talk for a second about the June 24th meeting. So Robert and Rosie, if you guys want to take it from here.
Yep, thanks, Clinton. And then also, just while I'm thinking about it, the subcommittee chairs, be sure to coordinate with Rosie and I. And in talking to our staff, these are still public meetings, so we'll need to notice them and we'll need to be in attendance. So please let us know as you're developing those timelines and schedules to include us. Yeah, I know. Look at Calandra shaking her head. Yeah. So on the agenda, we've set up some reimbursement procedures. So if you click on that link, it'll take you to a draft work group reimbursement procedure form. And it's pretty straightforward that, you know, if you're not an employee of the state or your employer is not paying you for the time that you're participating in this, there are funds available to reimburse you for that time. We'll have a form for that. Mileage, we can also pay mileage for the in-person meetings at 63 cents a mile. And then lodging if you live farther than 50 miles away. And then you have to comply with the state of Colorado's per diem and lodging requirements, which are also there are links to there where depending where in the state we are, it gives you a certain amount that you can ask for reimbursement for lodging. And then anybody asking for reimbursement, we have to get you set up as a vendor from the Department of Ag. So you'll have to fill out a W-9 form, which we'll make available. And then we'll need those requests within 30 days after the expense. So if you look on those procedures, if you have any questions, don't hesitate to reach out to Rosie and I. We can get those answered for you. But those procedures and the reimbursement draft form are there. Again, so if you're thinking you need reimbursements for the upcoming June meeting, definitely get us the W-9 form early in advance because it takes us a while to set you up as a vendor in the Department of Ag. And then after the meeting occurs, you can turn in those expenses. So last minute on the we're gonna have an optional training, in-person training for COMET training here at the Department of Ag. It'll run from 10 a.m. in the morning till noon. That's strictly in person for the.
Hey, Robert.
Yep.
I did talk with Chad, and Chad said that he was on board for exploring the hybrid if there weren't a like large enough group of people that were able to make it in person but wanted to. And I don't know if that's a option in the room that we'll be in, but if we only were going to have 2 or 3 people that were in person, we wanted to make sure that if people were interested that we could offer that. So I don't know if that throws a wrench in any plans, but wanted to throw that out.
Okay, thanks, Clinton. We'll keep that in mind. So we do have that. We'll send out the RSVP form for that. So everybody can let us know how many people are able to make it, and then we can make the determination from there.
Okay, that's great.
Yeah. So that'll be again, that optional COMET training will be in the morning, and then we'll have a hybrid work group meeting at our standard time from 1 p.m. to 2:30 in that afternoon, and that will be hybrid. And for those of you that are here, we will be serving lunch. So on that RSVP form, we'll have, if you could let us know who will be attending for lunch so we can make arrangements and if there's any dietary restrictions. And the RSVP form is there on the agenda as well. Any questions on that? We're excited to be able to do that too. And just so you know in advance, if there is some room available in the room, we're going to open it up to Colorado Department of Agriculture staff that are going to, if anybody is interested in doing it. So it may not just be work group members. If we have enough room, we'll invite CDA staff to participate as well since they're here. So great. Any questions on that? Just wanted to explore. We did way in advance. We had identified that the July 22nd meeting would be an in-person, was actually going to be our first in-person meeting, but now we'll have back-to-back in-person meetings. Jacob has been kind enough to line up a room for us at CSU Pueblo. Just wanted to explore the fact, is that still okay with everybody that we have back-to-back potential? We'll have hybrid meetings, but is that still okay that our July meeting then will be in CSU Pueblo? Any concerns with that? If not, we'll continue to plan then for an in-person July 22nd meeting, and most likely that'll be a longer meeting in person. We'll talk about, maybe Clinton, we'll need to think about this a little bit. That's a long time for a hybrid meeting, for online meeting. But originally we were thinking of having it from 10:30 to 2:30. So, but we'll set up an agenda there. And if you have any ideas for agenda items for that meeting, please feel free to send them to us as well. And
just to follow up on that, Robert, I know from our initial conversations when we were talking about that in-person meeting in Pueblo, not only was it going to be longer, but it was really an encouragement to get as many people as possible to be there. The June one came up kind of last minute with some other things that were playing out with the grant, or the Senate funds. But the July 22nd was to try and get as many people together as possible.
Yeah, great point, Clinton. And that's why we had pushed it back to that one, because on our original query of everybody, that was the date that was more people were available on. So
yep.
Perfect, good. Question?
JC had his hand up.
I was just gonna ask if Robert was gonna go the night before to make sure the air conditioning is gonna be working in Pueblo on July 22nd.
Yeah.
I'll probably be able to bring some really good produce, but we need some air conditioning.
Yeah. Yeah, we'll bring some ice packs.
Right.
I'll be the first to let you know if it's not working.
Thanks, Jacob. Oh, well, great. Any other comments or questions on that? Perfect. There has been some inquiries about the terms for appointees. In statute, there isn't any requirement or any length of term or anything. In talking with staff here at CDA, what I guess they've done on some other boards and commissions is that we just reopen it every 2 years. And then everybody can reapply, people can reapply, or if somebody is not interested anymore, they don't apply, and then we review those applications and provide those to the commissioner for final appointment. I do want to say, though, we're still on board with the fact that as part of our year-end report, if this work group identifies a group of individuals that we lack representation on, I think at that time, the commissioner is more than interested in appointing a new individual to represent a gap in representation that we may have, that we may see. Any comments or suggestions? Well, if you think of anything, please feel free to reach out again to Rosie or I, and then I'll work on some draft language to support that kind of strategy.
I'll defer to the whole on pros and cons of the term stuff, but just as a logistical question, Robert, does this group have a fixed number of spots? Is that how it works?
No, it doesn't. So it has a minimum number.
Okay.
That's it. And in statute, there are certain groups that have to be represented, and we met that. So we're meeting those requirements right now. But we can, it's just a minimum number. So we can have more. Again, it's the logistics of what's easy to work with, and then making sure that we have everybody represented.
Thank you.
But we can make a proposal for a max if we feel like that, 15 is a good number. We can recommend that to the commissioner. And then also, Robert, just to confirm, is this legislation create this working group through 2029 or 2030? 2029? Was that the sunset? Okay.
Yeah.
Great. Thanks. So there's essentially 2 more terms after this. Okay.
Any other questions? Great.
Well, nice job, Robert. We're right on time. So any public comments that people who may be watching from the public wanted to ask in person, the whole working group or an individual? I know the Q&A has been open, but
Looks good. No comments yet, Clinton.
right on. I'll pause for a minute. And then for those of you on the working group, the last thing that we were going to do is just make any announcement about any upcoming events that may be going on in your neck of the woods or that you know about across the state that you wanted to make this group aware of, or anybody listening. And I remember seeing, and Rosie, I might lean on you here, Julissa just sent out an email not too long ago about the event that she just held. Is that right? Or does she have another one coming up in June as well that she sent something out about? Or was it the one in May?
The most recent email was a thank you for the event in May. But there is, I believe, another event coming up, which I have posted on our website on the upcoming events. So there is an event on June 17th.
Excellent. And where is that located?
Oh, sorry. That is actually Catherine's event on June 17th.
Okay.
There is, Julissa's event is on June 8th in Delta.
Okay. In Delta. And Catherine's event that she sent the email out about is, where is it located?
That is actually virtual. So anyone can join the webinar from anywhere.
Excellent. Anybody else have any events that you want to make the rest of the group aware of, or that we should get on the calendar? I see that Calandra dropped off. I know she mentioned that they were going to be doing some tours, and I got an email that had all those dates on it where they'd be around the state, but maybe want to make sure that those make it on the calendar in case people want to participate. They seem pretty relevant. Wow, it sounds like a sleepy summer. I like this. I know that's not true.
Yes, I should mention, Clinton, that we did get 2 applications from organizations to put on the summit. So I'll be reviewing those, and by the next meeting, I should have a decision for you.
Sounds great. All right, then. Does anybody else have an update about anything that either has gone on since our last meeting, or something that is in the works that the rest of the team should know about? Maybe it's not scheduled yet, but it's in process.
This is way less exciting than that, but can we quickly approve last month's meeting minutes?
Oh, I totally missed that at the beginning.
That's okay.
That is exciting, Rosie. We got to make sure that that's done. And I don't know if we have a quorum, but I don't know if we need it. But did anybody have anything from last month's meetings that you wanted to get edited or questioned? Thanks for sending that out earlier, Rosie, so we could all review them. If not, I can't remember. Do we give a thumbs up for the approval? Is there a
I think it's just if no one has any refutations with it, then it's approved.
excellent? Any refutations? Sounds like it's approved, Rosie.
Cool, thank you.
Thanks for keeping us on track. All right, and this is your last opportunity to make any announcements on something coming up or in the works. Otherwise, I'm giving you back 6 minutes to your lunch hour. All right, then. Until June 24th, those of you who make it in person, it'll be good to see you if you can. We appreciate the effort. That'll be awesome to be in person. If you can't, hybrid meeting will work, but stay tuned for the follow up on the comment. But in one way or another, it'll be in person there from 10 to noon. And then I'm sure that the CDA will provide us a great lunch. So if you don't make it in person, you're going to miss out. All right, you guys have a great one. We'll see you in a month.
Bye, everybody. Take care. Thanks.
Bye. Thanks.